Good evening, everyone, and thank you for joining us on World No Tobacco Day for tonight's Ask the Experts panel discussion, which is one of the webinars in our Lung Life series brought to you by GSK. We are so excited to hear from our amazing panelists this evening who bring a wealth of knowledge and experience when it comes to quitting and cutting back smoking. My name is Bethany Verma. I am the Health Promotion Manager with Lung Saskatchewan, and it is my pleasure to welcome you and to be your moderator for this evening's panel. Before we begin, I want to acknowledge that I am grateful to live, work, and play and host this webinar on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the homeland of the Métis. As part of our work towards truth and reconciliation at Lung Saskatchewan, I want to acknowledge the role that tobacco plays in many Indigenous communities. Traditional tobacco is sacred, ceremonial, and respected, and in our work of supporting individuals who want to quit smoking commercial tobacco, we strive for and work towards providing culturally relevant support that respects and honors everyone who is on their journey to quitting smoking. Tonight's presentation is the second of our 5-part 2023 Lung Life webinar series sponsored by GSK. Lung Sask and GSK have a long history of working together on activities to improve the lives of those affected by various lung health conditions. This educational webinar series, Lung Life, was created to empower people to live and feel better. This is the third year of the Lung Life series partnership, and together, Lung Sask and GSK will be bringing you presentations on different health topics throughout the year. So just as you've joined us for this webinar, we hope that you'll join us for the remainder of the Lung Life series to hear from key opinion leaders in their respective fields of expertise to learn how to enjoy a better lung life. If you miss any of these webinars, we hope that you'll visit our website at lungsask.ca where you can find the recordings. Now we're going to show just a short video highlighting the Lung Life webinar series.
Inhale. Exhale. We do this at least 22,000 times a day. That is why we want you to live your best lung life.
The Lung Life webinar series empowers us to live our lives and breathe easier.
Lung Saskatchewan has partnered with GSK to offer a free 5-part webinar series featuring key opinion leaders in their respective fields of expertise, all with one goal: for you to live your best lung life.
We know that education, treatment, and support are vital for lung health, whether it's to manage an existing lung disease or to prevent lung disease altogether.
I have learned something new on every webinar that I've attended with Lung Sask.
The Lung Life webinar series offers a wide variety of topics, including disease-specific presentations, as well as education on lung disease prevention.
The Lung Life webinar topics include sleep apnea, asthma and allergies, pneumonia, COVID, and influenza vaccines, quitting smoking, and everything you need to know before you go for a spirometry breathing test.
The knowledge we gain from science and research makes for a better and healthier tomorrow. It is constantly evolving. The Lung Life webinar series helps you stay informed. Do you know that 1 in 5 Canadians have lung disease? Asthma is common but serious, and one of the leading reasons for emergency department visits in children. 30% of Canadians are at risk of developing sleep apnea, a disease where you stop breathing in your sleep. And of course, anyone with lungs can become infected by viruses that leave us breathless. These webinars are not only for people with lung disease, but for anyone with lungs.
Knowledge is power, and it can help us all breathe a little easier.
To find out more about the Lung Life webinars and to register, visit lungsask.ca. Missed a webinar? Don't worry. The recordings will be on our website for you to view at any time. Live your best lung life. Visit lungsask.ca today.
Awesome. So for tonight's panel discussion and for the other webinars in the Lung Life series, they would not have been possible without GSK, which is a science-led global healthcare company with a special purpose: to unite science, technology, and talent to get ahead of disease together. The Lung Life webinar series is rooted in science and utilizes technology to make education from experts accessible to you wherever you are. I'm pleased to welcome Marie-Claude from GSK to bring greetings.
Bonsoir everyone, my name is Marie-Claude Desaulniers and I am the Patient Engagement Manager at GSK in the Patient Affairs and Advocacy team. In the scope of our work, we engage with patient organizations by listening to patients throughout the life cycle of our medicine, integrating those insights into our business planning to improve patient outcomes. GSK is very proud to collaborate with LungSask and to support the 2023 Long Life webinar series. LungSask is providing you with accessible, practical, evidence-based information and strategies coming from key leaders in their field of expertise. The topics of these webinars have also been chosen based on your feedback, which is so important to listen to in order to bring the relevant informations which we hope will help you live a better long life. Thank you very much and have a great evening.
Thank you, Marie-Claude. We are grateful for your collaboration, support, and the work that GSK does to help people feel and live better. Supporting and helping people affected by various lung diseases and threats to lung health is a priority for LungSask. We offer a variety of online support groups, which inspire many of our educational opportunities, like webinars such as these. Our support groups include asthma, COPD, pulmonary fibrosis, COVID-19, lung cancer, lung transplant, sleep apnea, and the Saskatchewan Quit Smoking Cessation Support Group. Our Saskatchewan Quits Facebook support group consists of individuals across Saskatchewan and beyond that are at various stages of their quitting journey. Whether you're thinking about quitting, you're in the process of cutting back, or maybe you've already quit, we would love to have you join us on Facebook at Saskatchewan Quits if you're not already part of the community. So tonight is all about the advice of our panelists when it comes to helping you on your journey to quitting or cutting back smoking. Throughout the next hour or so, if you have any questions for our panelists, and we hope that you do, please type them into the question feature of the GoToWebinar platform. You should find this feature in the control panel on the right hand of your screen. Please don't be shy to ask your questions. Chances are someone else has the same question as you, and our panelists are here to provide support with a wide scope of expertise. I now have the pleasure of introducing our panelists for this evening. We'll go from left to right across the screen there. Jennifer May is the Vice President of Health Promotion and Government Relations at Lung Saskatchewan, and she is celebrating her 25th year working in tobacco control. Jennifer manages provincial respiratory health promotion activities, including education, prevention, and cessation initiatives, advocacy for tobacco control, radon awareness, and environmental issues, and she is a co-founder and adult advisor of the Provincial Youth for Change group. Her passion is advocating for change to protect public health, and she's participated in government relations and advocacy efforts that have led to Saskatchewan's provincial tobacco legislation in 2004, and asbestos bill in 2013, and vaping legislation in 2020, as well as scores of other policies and municipal bylaws. Dr. Erica Penz is an associate professor in the Division of Respirology, Critical Care and Sleep Medicine at the University of Saskatchewan, and a program director for the Respirology Training Program. She has a particular interest in smoking cessation and the interaction of vaping and smoking among youth, and is a co-founder and co-facilitator of Youth for Change, an education and advocacy youth group aimed at protecting children and youth from the harms of vaping. Corey Gambler is a youth counselor at leading Thunderbird Lodge Addictions Facility. He previously worked with the File Hill Qu'Appelle Tribal Council, which is situated on Treaty 4 territory and provides services to 11 First Nations communities. For the first 10 years with the Tribal Council, he worked at a treatment center for First Nations youth who have had addictions affect their lives. For the next 4 years, he worked with FHQ Health Services running a tobacco cessation program. The program looked at helping people to cut down and/or quit smoking by the use of nicotine replacement therapies, quit smoking challenges, and with cultural teachings from elders in the communities. Chris Berg is a practicing pharmacist that currently works for the Pharmacy Association of Saskatchewan, or PAS, as the Director of Professional Practice. Prior to his work for PAS, he worked for 6 years in community pharmacy and continues to work part-time in a local community pharmacy in Regina. In community practice, his area of focus was mental health and addiction, where he would often encourage individuals looking for support with smoking cessation. Chris is a PACT certified pharmacist. PACT stands for Partnership to Assist with the Cessation of Tobacco, and has utilized his training to help support individuals through their smoking journey. Rhonda Watataka joined the LungSask Saskatchewan Quits Personal Challenge in 2021 and has agreed to be an ambassador for the campaign the following year. Like many people in Saskatchewan who smoke, Rhonda started smoking at a young age. She quit for the first time in 1999 and has stopped and started over the years. Rhonda is excited to share her journey with you and to encourage and support you on your journey to quitting or cutting back smoking. So I am so delighted to have the 5 of you here today. I know that we can't see Rhonda due to some technical difficulties, but she'll be able to speak when questions are asked to her. The other 4, we can see you, we can hear you, and we really do have a wide variety of expertise and knowledge on the panel today. So for those of you attending, please ask questions because these panelists will have wonderful answers for you. And with that, I think we'll get to it. So we can stop sharing that screen and just move into some Q&As. So we did have a couple questions come in with registration. We'll start with those, but please do ask questions through the question panel on the right-hand side of your screen. So one of the questions, it wasn't as much of a question as just a prompt for discussion, but we'll start there, was let's discuss fear. So the fear that comes with quitting. What can we do about it? How can we manage it? What are different ways that we can approach it when quitting smoking? So I'm going to open that question to anyone on the panel if someone wants to kick it off, and then if anybody would like to follow up afterwards, please do so. I'm putting you on the spot by not calling anyone's name, but please share if you've got a thought on how to address fear when quitting or cutting back smoking.
Do you want me to start, actually,
Sure,
Bethany?
yeah. Go ahead, Erica.
Okay. Well, so fear is actually, it's such a common thing that I hear from my patients that I see and who are trying to quit. Or sometimes it's actually after the fact that they, having gone through that, really realize how afraid and uncomfortable they were feeling thinking about quitting smoking. And I think some of that might relate to, I think there's so much that goes into someone's experience when they're using commercial tobacco. And if I could just, maybe I'll speak to something that I feel a little bit more comfortable, which is actually the physiologic parts of nicotine that people have. So it's a highly dependent substance. And when we actually, so it can get to the brain within 10 seconds, it wears off within a number of hours after we're sleeping. So by the time we wake up in the morning, many people actually have that physical craving and need for some more nicotine to sort of help to make them feel to activate those receptors that actually bring pleasure, activate dopamine and all those things that are associated with it. So when someone is actually trying to stop or cut down, and that physical act of reducing nicotine can actually worsen those feelings of withdrawal from it, and that can make people feel anxious, which creates a lot of fear. So there's actually a very good physiologic explanation for some of those feelings, and maybe there's a lot more to it that maybe others may want to speak to about this issue of fear.
Yeah, thanks, Erica. I think that's a really good point, though, that sometimes it's like, oh, I shouldn't be afraid of this. Like, why am I afraid? But you're right, there's a physiological reason for it. So you're not alone if you're feeling that, if you're trying to quit. That's a really good point. Corey, do you want to go next? I'll just start tagging people.
Sure. From being an ex-smoker, I think a lot of it was fear-driven. Trying to, even just the thought about quitting and then just having the withdrawals and things like that, it overwhelmed you at times. And I think now more so ever, with people's mental health and it being always at a rise with anxiety, I think that kind of plays a lot of it too as well, to that fear aspect and stuff like that. So a lot of people have that struggle back and forth. I want to quit, but I'm afraid, and I have anxiety on the other side of it too. So for me, speaking is fear. It probably driven me for a long time, but once I got over the fact that my mind made it up, my mind said, enough is enough. I need to move on from this. I try to keep myself busy, things like that. When I did feel that fear was at the highest point, I try to keep myself busy, to keep my mind busy, and it did help with that, lowering that fear part of it. So
Yeah, for sure. No, that's a great response. Chris, do you have anything to add?
Sure, Bethany. So I would just talk, like, when I'm talking to a lot of patients, a lot of them do come with, a lot of fears about what's going to happen when they're quitting smoking. This may come from things that they've heard from friends or things that they've experienced in past attempts. And I think the first thing to recognize is that all of these fears are normal and valid. And so one of the activities that I generally would work with someone is write down what your fears are. And that way we can unpack them, address them, talk about them before you even start quitting smoking, so that we can come up with strategies that are specific to you on how to address those fears. So and also rank what is going to be your biggest fear, so then we can put a little bit more emphasis on there. Some people are very afraid about weight gain because they hear about it. Some people gain weight. Some people don't actually gain weight when they're quitting smoking. But knowing how important weight gain is to you will help tailor some of the other activities that we may want to emphasize on that will help make you more successful, like diet and exercise activities and stuff that we might want to pre-plan before we even work into the quit date and attempt. So I think the most important thing with tackling fear is to actually tackle the fear, bring it right up to the front and talk about it before you even start talking about quit dates or anything else in your quitting journey.
Awesome. I love that. Yeah, like you got to bring it to the front. Otherwise, if it comes up later, like now you're getting ahead of it if you do it before you're like you said, tackling other things like quit dates. That's great. Jen, do you have anything to add?
Yeah, sure. I think anytime, just as humans, anytime we're enlisting change in our world, it's going to create fear. And I think, like Chris mentioned, it's a very normal response, and it's something that we hear quite a bit. It doesn't matter what we're changing in our lives, right? I do think that, for a lot of people, they've said, well, this is my best friend. Like the cigarette has become my best friend. It's my coping mechanism. Like, what am I going to do without it? And so I think that that's the piece that we just have to help, rewire some of that thinking, create some new habits, looking at the addiction aspect, how are we going to deal with the nicotine withdrawal as we go? But, people who do quit always tell us, this is definitely a journey. This isn't a one-time only deal and then it's done, right? It's a journey and we're going to learn as we go. I'm a big believer in watching the language that we use, because I feel like it puts so much pressure on people. And the whole idea around this is not to feel pressure, not to feel shame, not, yes, you may feel fear, but there are so many people and resources there to support you, to help you through that journey, to understand that, it's going to ebb and flow and that's okay. And so I just wanted to remind everyone that, we very much come from a space of understanding the addiction. There's physiological impact, of course. There's the addiction piece. There's also very much a psychological piece to this, and we're here to support that.
Awesome. Thank you so much. I'm going to check in with Rhonda. I know she was maybe having some technical difficulties, but Rhonda, are you with us? Okay, maybe not yet. So I'll hang tight and wait for Rhonda for maybe a different question. So we'll move on to another question, but thank you so much, panelists. Those are all great responses and hopefully can help. With fear being a really big aspect of quitting, I think that those are all some really good tools that that people can move forward with. The next question is quite timely with the season. I don't know if you're all around the Saskatoon area or wherever you are, but it's been very hot outside. So this question is quite timely. As the weather gets warmer, I'm outside more and I want to smoke more. How can I manage the trigger of being outside, whether it's at the lake, on the golf course, etc.? Maybe I'll just tag someone again. Corey, do you maybe want to talk about triggers and how to manage maybe being outside when it's so nice out wanting to smoke?
One of the things I asked people, even before we planned on being a lifelong smoker, what did they do before when they had those external stressors? And a lot of the times people don't really come up with an answer. They're like, well, I don't know. So I get them to kind of explore before they even started to smoke cigarettes, and try to get them to go back and revert back to that memory bank and kind of, try to come up with brainstorm ideas for themselves, because a lot of people don't, when they start smoking, they don't intend to be lifelong smokers. It's with the season and everything like that, when it's winter time, nobody wants to go out and smoke, right? But they still go out there and they still do that, right? So in the summertime, it even makes it even worse. When it's hot out, you want to be outside, you want to smoke, right? So it's kind of, I find it's more tougher for people during the summer try and not be out there as much and smoking as much. Whereas kind of winter time, I kind of, kind of use those elements of the coldness and stuff like that to kind of, deter them from going out and having a cigarette and stuff. So, but I try to get them to think before they even started any of that. What were some of their coping mechanisms they had before that?
Yeah. No, that's a great idea. Thinking about what you did before. How did you handle that before? And also, a recent study came out. Fun fact: that most people try to quit in the winter time in Canada. So I wonder if there's a correlation to the weather there. I would imagine that there is. Chris, do you have anything to add around managing triggers like being outside in the sunshine?
Absolutely. I think this is where we're going to go into a little bit on the medication part because I'm the pharmacist. But what I talk to a lot about patients is identifying some of those, really tough triggers. And this is a part where like the nicotine replacement can be used as like a pre-planning part. And so especially those tough triggers that we are going to have a craving, because as Erica said, cigarettes, you get nicotine in like 10 seconds in your brain. All of our NRT does take a little bit longer for it to hit your brain. So if you're using your gum or your lozenge or your inhaler or your quick mist before, you're now pre-planning some of these hard triggers. So you already have nicotine on board to help get you through these cravings that are going to be coming anyways. So if you are like, I'm going to go for a walk, I always want to light up within 2 minutes of me going outside, pop the gum in before you even walk outside. That way it's on board before you even get there. And then we're gonna focus on tapering back on those tough cravings a little bit later in your journey. Because let's just be on board right away. The other part, as Jennifer said, a lot of smoking is a habit as well. So if you're always, seeing that you like to smoke when you're going golfing, and that's like an ingrained activity, it may not be the best time to be going golfing depending on where you are in your activity. So it might be better to pick up other outdoor activities that are different than golfing, pick up some different hobbies to try and break these connections. And then when you're ready, go back to some of your more favorite activities as well. So just also trying to identify some of those triggers and then replacing it with something similar but different to trick your brain into disassociating the two so that you can focus on each activity separately.
That's great. And we know that in Saskatchewan, there's lots to do in the summertime. So hopefully people can find some alternatives. That's awesome. Erica, anything to add?
No, I think those were both really great suggestions. I wouldn't add anything actually.
Okay, great. Jen, anything?
It just reminded me that everybody has different triggers. And so, it's just really important to really reflect and identify what your trigger is. And like Corey said earlier, figuring out a game plan ahead of time to figure out how to replace them or how to deal with them when you are triggered. So yeah, great suggestions.
That's great. And I'll check in again. Rhonda, can you hear us? And are you able to maybe share from your experience how you've managed triggers? I know she said that she was with us, so I'm not sure, Joe, if we can work to unmute her. Okay, well, maybe we'll try for the next one. And Rhonda, if we're not able to get your sound, then maybe if you want to throw some answers in the question boxes, I'll be able to see them and read them. But we'll really try to get your sound working because I know that you're here, so we want to make sure that works. But for now, we'll move on to the next question. We had a question come in asking about the difference between commercial and traditional tobacco. So can you please tell me how commercial tobacco is different from traditional tobacco use? And are there any programs in place to inform the public about the differences? Corey, maybe we'll start with you for this one, maybe elaborating on the differences.
Sure, yeah. I'll start with traditional tobacco. In our different, different provinces, different tribes, things like that, they have their own way of utilizing, commercial tobacco and traditional tobacco. I'll just speak for Siksika Nation in Alberta. They actually, what they do is when they use traditional tobacco, they'll go through a 4-day ceremony for that. And what they'll do is they'll dance and sing for 4 days, and they'll make what they're called beaver bundles, and they'll have the tobacco plants in there, and they'll have it and they'll put it out into a field, and they'll pray and sing for those 4 days to ask for that tobacco to grow, like, you know, from the creator to grow it and have it to be utilized for ceremonial purposes. So, but like in today's age, we always look at ceremonies, and a lot of times we're always using commercial tobacco, because that art is kind of going away, of growing that natural tobacco and utilizing it for ceremonial purposes. So when we do have natural tobacco, it's nothing like commercial tobacco. It doesn't have all the additives, the nicotine, everything like that. So when you're attending a pipe ceremony, you're told not to inhale that tobacco or that smoke, even when you're smoking like traditional tobacco. So when there's times when you do present an elder with, a pouch of tobacco or a pack of cigarettes, it was always taught to, you can either, if you don't smoke, you can give that away to someone. So a commercial tobacco is totally different. So even when we do use commercial tobacco, there's still always that respect aspect of it, that you're using it and you're going to pray with that tobacco. You're offering that to the creator to help with your prayers and things like that. So those are the kind of two differences a little bit on that.
Sorry, I was muted. Thank you so much, Corey. That's really beautiful. And it's, I think, a really good education piece, because I think a lot of people don't necessarily know the differences. So then to build on that, to kind of the second point of that question, are you aware of any programs, or maybe do you have any community events that you would recommend that people check out to learn a little bit more, or to become a little bit more educated? And I guess that question can go to Corey, but also to other panelists that may know of any programs out there.
As far as programs, like the program that I was running, it was greatly involved with the elders, and the elders would come into the communities and especially talk to our younger kids and get them to understand what the difference is between commercial tobacco and traditional tobacco. And that was kind of like the program that was kind of run in the Treaty 4 area, and not so much now. I don't know if it is still moving forward, but as far as that in my area, that's pretty much the only program that is available.
Okay. Any other ideas from other panelists of either programs or events that, or even just websites or resources that might share a little bit more about traditional tobacco?
I think the Smokers Helpline, Beth, has a component called Talk Tobacco, with very much a First Nation kind of focus in their counseling. So that's a good one, I think, for a good resource for people to tap into.
Yeah, really good point. I've heard good things about Talk Tobacco.
And can I also just mention that we've been working with our Youth for Change groups in a couple of the First Nation communities, and Corey, you were part of this group as well. It's supporting the work that Carry the Kettle First Nation did, and they came up with a video actually to share with the world, really, but on the differences of traditional and commercial tobacco. So maybe perhaps, Beth, that's something that we can, if people want to see it, we can put that up on our website, and you can go and have a look at what the youth and Elder Clyde Watch with their teachers put together. It was really well done, and it's a really good showcase, I guess, of the difference of traditional versus commercial.
Yeah, and actually that's a really good point. I can include the link to that video in the follow-up email that we'll send out after the webinar. So more details at the end of the webinar about that email, but I'll make sure to include the link there. Thanks, Jen, for that reminder. Okay, one of the questions that's come in, it's quite detailed around nicotine patch. So this will probably be a question for Chris and maybe Dr. Penz. If someone has quit smoking using the patch, is it okay to stay on the 20 milligram patch longer than what's recommended on the packaging? What advice do you have for when patients know when to step down in the patch dosaging out of fear of having a setback if they're doing well on a particular dose? Chris, do you want to kick it off? Did that all made sense? That was good.
That absolutely makes sense. Like, that is a very common concern. And what I tell patients is the right time to step down on your patches is when you feel ready. There's the stuff on the packaging is guidelines. They have to have some sort of date on there because that's what Health Canada wants them to have. But there's no harm associated with you not following those dates at all. So if you're not ready, then it's not the time to step down on therapy. It's not a rush. There's no, race to the finish here. You don't have to complete everything in the 8-12 weeks as recommended by the manufacturer. So if you're on, step 1 for 12 weeks before you're even ready to step down, that's fine. I've had patients that have taken years on the patch, and the important part is they weren't smoking when they were on the patch, and that is a win in and of itself, and that means that the journey is working and we are getting somewhere, and that is all that really matters. At the end of the day, you just go at your own pace, and you as yourself will know when you're ready to do your step down.
Yeah, that's great advice. Thanks, Chris. Erica, anything to add to that?
No, I think that makes perfect sense, and I just wanted to maybe reinforce what Chris was saying is, these are recommendations, and what you'll find is as you're going through your own journey and process that that may not be exactly what works for you, and so being open to and the great thing is, and I'll do it as a plug. So our pharmacists, so Chris is incredibly knowledgeable, but these are awesome questions that pharmacists, many of our pharmacists across our province are very trained in and around smoking cessation, so they can answer, and give advice around if you're sort of wondering and questioning whether you're ready to transition. You can pop into the pharmacy and or make an appointment and talk about all of this. So yeah, it's a great resource.
Yeah, excellent. Really good point. I think some people don't necessarily know that their pharmacist is available to help them quit. So I'm glad you highlighted that. Awesome. Next question. The mind is the most difficult. Suggestions on how to change our thinking. So not always thinking about cigarettes and to make new habits. So there's probably lots to say about that question about changing thinking, reframing our thinking. Jen, you haven't answered a question first yet. I'll let you go first.
Well, you know what? I guess for me, it's really important for people to understand that nicotine is only in your body for about 72 hours. And a lot of people don't realize that, right? And so, for us, we look at the withdrawal symptoms after that point. We'd be at, your nicotine level, depending on how much you've smoked and for how long, will be at a certain level. And that's different for everybody. And so we hear this a lot. Well, I tried the patch before, but it didn't work for me. Or my brother's sister's nephew tried it and it didn't work for them, right? And so I don't want to try it either. And so the important thing is to realize that everybody's nicotine tolerance level is different, that it's really important that we what am I trying to say here? It's really important that we understand that. First of all, I want to say, just based on the last question as well, Beth, nicotine addiction is the only drug addiction that we expect people to go down aisle 5 of the drugstore and self-medicate. And so it's so important that we really do reach out to our healthcare providers to assist us with that. And then can you remind me, sorry, what your initial question was, just so that I can skip that?
Sorry, let me just find it again just so I ask it correctly. How do we change our thinking?
Yes. So after the 72 hours, it's important to understand that a lot of what is triggering you is certainly the withdrawal, but it's really a lot in your mind, like this lovely client has asked, right? It's really about changing some of the ways you've done things. So for example, in the morning, if you always get up in the morning and you drink a coffee and have your cigarette, for example, we might want to look at changing some of that. When you smoke, it actually affects how you metabolize caffeine as well. And a lot of people don't understand that. And so if you quit or you knock down your nicotine, what you're taking in with nicotine, you also need to match that with your caffeine level, because you metabolize it differently and it can make your stomach upset. And then a lot of people will be like, oh, I've got such an upset stomach because it was from a caffeine hike, not from quitting smoking, right? So it's just little things like this, little tweaks that your healthcare providers can help assist you with. And then things like maybe instead of a coffee in the morning, or you try it at different times, we go for a walk in the morning, or there's just different things to try to get out of those things that trigger your mind as far as, again, that habitual piece, right? So I think that's the biggest one. And making a plan, what is your why? It's so important to have your why. Why are you doing this? And I think that's a really good reminder as well. I'll leave it at that and let the others respond.
No, that's great. Thanks, Jen. Chris, anything to add? How to reframe our thinking?
Sure. So just in some of my counsels with people with the PACT program, I focused on, as like Jen alluded to, like, you know, breaking up habits and reshaping how we go about our day. So for example, as Jen, just building on the example of the coffee and cigarette. So if that's how you start your day, if we don't break that, it's going to be really hard for you to reshape your mind. And so substituting out the coffee for, like, get up and make a smoothie for yourself in the day, or get up and immediately have a shower, or some sort of different change of habit will help break and disassociate that. Another activity that I have some people will go through is, because you enjoy smoking, you like smoking, it's your, you know, go-to buddy, we'll go through a short activity just before your quit date of making smoking unenjoyable. And this is where you throw out your favorite brand and you buy whatever you hate. And whatever is disgusting, you have to smoke with your other hand, you have to use matches instead of a lighter, and basically everything that you find inconvenient or terrible about smoking, you're gonna do that for a few days. Not for too long, because then you'll just adapt and it will become your cheap norm, but basically a few days for the first week, you're going to focus on making it unenjoyable for yourself, to also then help reshape your mind on how you perceive smoking. If you see it as more of a chore and an unenjoyable activity, it's easier to disassociate that from the things that you enjoy instead.
Awesome, thank you. Corey, anything to add?
Yeah, no, I think they covered quite a bit there. I would say that, you know, if we have any First Nations people in our webinar today, you know, like, one thing that helped me is our ceremonies, going to our sweat lodges. That really helped shape that mind and change that mind, that thinking, you know, sitting with that elder, talking with them. And, you know, a lot of times when you get those stories and you get those a creation story of, like, tobacco and things like that, it kind of really gets you thinking on how this tobacco is, like, kind of controlling you and getting you to think differently about it. Because most of the times we don't think of tobacco as a bad for us, but when elders talk to us, they always teach us about, it wasn't meant to be bad, but it is. If anything in life, there's always something, you know, there's always a good to it, you know. So they talk about that quite a bit in ceremonies and stuff like that. So changing your mind thought, like, just like Kristen said, in the morning, you know, if you have a coffee and a cigarette in the morning, you know, like Chris said, you know, possibly a smoothie or whatever, or even a healthy snack, banana, whatever it is, for that, you know, 3 to 5 minutes that you do have, you know, that nicotine withdrawal. You know, that's what I always tell them. It's going to be 3 minutes. If you can get through the 3 minutes, you know, you can get through that one step, right? So.
Yeah, that's great advice. Erica, anything to add?
Yeah, I think I was thinking that maybe I might just mention, so we've got 2 oral medications that people can consider using to help them when they're quitting. So in addition to sort of some of the planning and the behavioral strategies and all of this, and even we were talking about nicotine replacement, like patches or gum, etc. 2 other pills exist on the market, and so bupropion and varenicline. So varenicline, or the other name for it is Champix, and many people have had experience using it. What I wanted to mention about it is, and it kind of relates to this part of when you're quitting and trying to sort of change the habits and your go-to, is that varenicline is actually an interesting drug in the sense that, well, it binds some certain receptors. It's a big long name of the receptor that it binds. We don't fully know the whole mechanism, but what we do know is it kind of actually helps in 2 ways. One is it does help with reducing your nicotine withdrawal, because it's binding a receptor that your nicotine would otherwise get bound to when you smoked your cigarette. But it also reduces the pleasure that you get from smoking. And so actually there's been new studies in the last number of years that have shown, so even in those people who say, I'm not even ready to set a quit date, I'm not even actually thinking about it, when you start individuals on varenicline, they are actually more likely to quit smoking and remain abstinent than somebody who also was equally not interested in smoking and left to their own devices. And we think it's partly because of the action of this medication, that it actually reduces that pleasure. Actually, if you try to smoke when you're on varenicline, the first week you're allowed to, but it changes actually how your body responds to that nicotine and makes it, again, as Chris was talking about, not a pleasant experience. And so that can actually help people. So I think when we're also, if people are interested in wanting to consider and learn about pharmacologic options, some of the oral medications, particularly varenicline, that probably has the best evidence to date out there, is something you do need a prescription though for that medicine. But it is available in our province for people. And Chris, you may want to even speak a little bit more to that.
Sure, Eric.
I don't want to put you. Yeah.
No, that's totally fine. I can just add in a little bit more. I think this might be a good time, Bethany, for me to talk about like the pharmacist prescribing for these agents. So as Erica said, there are 2 prescription agents that are on the market, varenicline or Champix, or bupropion or Zyban. So they do require a prescription. However, in Saskatchewan, pharmacists are allowed to prescribe it in most cases for people. And so this, if you don't have access to a doctor or a family doctor, you can go to any pharmacy in Saskatchewan and have these agents prescribed after a short assessment with the pharmacist. So they are quite accessible. Varenicline is covered by a lot of insurance companies. It is on the SAS drug plan as well as the NHP formulary. However, it is only covered for a 12-week period, but people can be on it longer if needed. So people can do up to another 12 weeks through a pharmacist, or even longer through their family doctor if they so choose, if they are finding it's beneficial and they're not quite ready to stop the medication as well. Zyban is generally only 12 weeks. There's not really much evidence that going any longer with that one improves any outcomes. The other nice thing about these medications is they can also be combined with nicotine replacement therapy as well. And so when we're talking about medications, it's not, well, varenicline or Champix is the most effective evidence-wise. I like to mix and match with patients and also base it on their own preferences. So these are great things to bring up when you are talking to your pharmacist or your doctor about your preferences and what you're interested in trying as well. Because right now we can basically tailor it to your own individual goals and needs as well, and what you're interested as well. So like the patch and like the gum and varenicline, they can all be combined together if you are extra nervous or you just have had a lot of quit attempts and you want to try a combination approach. That's completely fine as well. It's all based off of what you want and what you think will work best for you.
Awesome. It's good to know that the whole arsenal is available.
Yeah. And the proof is there, right, Chris? Like the proof is there as far as the efficacy of using those NRTs and the medications. And I think that's important. Like we get a lot of people that say, well, I don't want to go on a medication. And so what would your response be to that? Because we do hear that quite often.
So there's a lot of evidence that these medications work and that they're safe to be used in either solo or in combination. 100% understand some people are nervous about the medications because they have side effects. And that's something that is also helpful to know upfront as a pharmacist. Have you heard about the side effects? What side effects are you nervous about? And that way I can talk to you specifically about your concerns about the medication before we start you on it. So it is really helpful to know what you've heard, because there is a lot of misinformation about these medications as well. So if you have something concerning or specifically, and if you are wondering if it applies to you, those are questions that can be brought up specifically with your doctor, your pharmacist, and then we can address your concerns upfront. I think the one that I really want to talk about that seems to be in the media, it's not so much anymore, is the increased risk of like mental health disorders with these medications. And so that's been coming and going, and what even though it is something that's on the packaging and the warnings. There is more recent evidence to show that that is not necessarily seen with Champix when we're looking at more robust studies. Stuff that's been reported in the post-surveillance data, but more robust studies show that it doesn't really increase your risk of depression or anxiety above the already increased anxiety and depression that goes with quitting smoking. However, this is also a reason why they're prescription medications, and that why they're prescription medications, it means that you're having follow-ups and check-ins with your pharmacist and your doctor to see how things are going. So those are questions that we'll be asking. If you're having thoughts of suicide or seeing worsening depression or anxiety, you bring that up with your healthcare professional right away so we can address it. So that way, that's the whole reason why they're prescription meds, so we can follow you and help you through your journey. And so things that are said, but they're not seen all that common. I've never actually seen any of my patients ever experience those side effects myself in all of my patients that I put on Champix myself. Awesome. Erica, do you want to add anything?
No, fully agree with everything you've said, Chris. And in my experience too, and I've used Champix a lot with my patients, or I've had many of my patients who've also told me about their experience. I've not had worsening. I've not had any suicidal ideation expressed by my patients. Although I talk about it with all of my patients when we're discussing that medication. The main concern that I've seen most with Champix would be dreams. So some really vivid and sometimes really disturbing dreams, and that has affected some people's ability to stay on the medication. But again, and it's not every time. So they've, they may try that, have to stop, and actually have had some patients go back on it because they've wanted to give it another try and not had the same side effects. So again, something for just people to know and have a conversation about and monitor.
Yeah, that's great insight. And I think a couple of comments coming in about, oh, I agree, or that's helpful to know. So that's really good. I think if I understand correctly, we have sound for Rhonda now. And I do know that Rhonda has used Champix. And so I would love to hear your thoughts on your experience using Champix, Rhonda, if you're willing to share like how that's helped your quit journey, whether you found it effective, etc.
Hi, can you hear me?
We can.
Hi, I'm sorry I'm late.
No, that's okay.
But with the Champix, I had to do two. I quit for 3 months, and then after that, I started smoking, and I tried it again, and I am currently just over 3 months smoke-free again. So I think the Champix really worked for me. It helped me. The dreams, the vivid dreams were there. They were sometimes, like, they were very vivid. And, but yeah, I just want to say that I really liked the Champix over the nicotine patches. I tried the Nicoderm, and it didn't really help my mind psychologically, I think, or mentally prepare me. So the Champix, it did make it unpleasant. It made it like, it made me sick, like nauseated to think about smoking, and I think that really helped. I'm not sure if that helps or answers the question.
Yeah, absolutely. I think having that real life experience using the medication, I think, is super insightful and good to know. So I'm glad that you found it to be effective, even if that means that it's really unpleasant.
Yeah.
I also want to circle back to the original question that got asked, and then we went on a really beautiful tangent about different medications. But Rhonda, now that we've got you on mic, I'd love to know your thoughts on how can you reframe your thinking. So what's been helpful for you in quitting to reframe your thinking, whether it's maybe changing a habit to kind of digress from smoking or something else? How have you reframed your thinking?
It's a lot of positive self-talk. I know I've reached out to you a couple of times, but it's just a lot of self-talk. If I can just make it through another day, or like the I guess that urge to light up a cigarette, if I can just make it through that, then I'm good.
Yeah. Yeah, no, we have had a couple of conversations, and you do a really great job of just, yeah, like you said, kind of getting through to the next moment, right? Like whether it's
Yeah.
talking through it or thinking about what's next. I think that's a really great tip. Thanks, Rhonda.
Yeah.
Awesome. We have a couple more medication questions coming in, so this conversation is definitely spurring Q&A around nicotine patches, medication, etc. Someone has asked, so medications to quit have made me feel really unwell. Suggestions of proper usage of these medications. So again, I'll probably turn to Erica and Chris, whoever wants to kick that one off.
Sure, I can start first. So I guess if it's making you feel unwell, like the first step would be like talk more specifically with your doctor or pharmacist exactly about what you're feeling unwell about. Because depending on whether it's nausea, whether it's problem with dreams, etc., will give us a little bit more information on exactly what is causing that. For example, like nicotine patches, they can cause some disturbing dreams at night as well. And so some people will take it off before they go to bed and then put it back on first thing in the morning. The only thing when I warn with people that do that is now you don't have nicotine on board first thing when you get up. So you might want to have a lozenge or something like that right by your nightstand, so you're ready to take that right away in the morning before you apply your patch for the day. Other thing with those nicotine like gums and that kind of stuff, if it's upsetting your stomach, it's because you're swallowing it. And all of those things are actually designed to be absorbed in your cheeks. And so like the gum, you're at least supposed to chew it a couple of times and then park it in your cheek and let it absorb in through your bloodstream. If you're really chewing it like you chew regular chewing gum, then you're putting a lot of it down in your stomach and it's going to upset your stomach. Same with the lozenge, park it in your cheek. All of those are designed for it to be absorbed here, not to be necessarily swallowed as well. As with the prescription medications, it can cause some upset stomach. Taking it with some food, so having some food in your belly before you take your medication and then drinking a glass of water with it can help with the stomach upset, as well as both Zyban and Champix can cause some problem sleeping at night as well. So making sure that you take your doses earlier, so around supper time as opposed to bedtime. So you've got more time between your dose and when you go to bed. So it's not causing problem sleeping at night as well and making you feel unwell because you're tired, because you had a restless sleep the night before because of the medication. So these are all very like general things, but talking more specifically with your doctor and pharmacist can help figure out exactly why the medication is making you feel unwell.
Yeah, that's great advice. Thanks, Chris. Erica, anything to add there around the medications?
No, I mean, I think the point around being like sort of picking out exactly what it is that you're noticing and trying to sort it out is useful, because so I hear this a lot with my patients too, who the first time I'm seeing them, for example, the response when we do talk about them quitting or what they've done, they've tried everything and it didn't work, and it really isn't. So I've learned and kind of trained myself to say, well, let's actually talk about this specifically. What is it that didn't work, et cetera. And that's actually, when you talk about the details, you kind of find out, oh, well, that's interesting. We could probably actually try it a little bit in providing an explanation. And then somebody's like, oh, that makes sense. So that, I think that's a great point about the side effects. And then, to be honest, some people truly have side effects that will persist with the medications, and they're not the right meds for you then. And that might just be okay. And that doesn't mean that you're, not going to have success eventually in your journey. It just means that you may not necessarily have that extra boost and benefit from that medication, but it is entirely possible to still quit without them. So I just wanted to make sure that that message is clear too. It's not essential. for you to find success if you can't tolerate those medications.
That's great. Thank you. The next question will be, oh, sorry. Yeah, Jen, go ahead.
Can I just remind everyone that if you are an avid caffeine intake coffee drinker, this is a good time when you do start to go on to NRTs specifically and meds that you do also decrease your caffeine intake, because that can make your tummy feel unwell as well. And then sometimes like I said, the quitting smoking piece gets the bad rap for it, but it's actually, we have to just remember to decrease our caffeine use as well. That's all I wanted to say.
No, that's a great reminder.
Your pharmacist and your physician will help you decipher that, right?
And thanks, Jen, for bringing it up, because that just tweaked my mind of just a reminder that besides just caffeine, smoking actually interacts with a lot of your medications. So if you're on a lot of different medications, part of the reason why you might be feeling unwell is now some of your medications are working a little bit better than they were before. Smoking does, and it's very medication specific, it's not for all medications, does decrease the effectiveness of many medications. For example, like insulin for diabetes. And so when you quit smoking, all of your medication doses without actually changing doses can go up. And that can be causing other side effects. And so that is why it's really important to talk to your doctor and pharmacist about this, because then we can kind of try and figure out what is the actual problem for you, and then we can make adjustments for you as well.
That's great, thank you. The next question is for Rhonda and for Corey as well, with your experience with quitting. So maybe we'll start with Rhonda and then go to Corey. What was the most difficult part about quitting for you, and what did you do to manage it? Rhonda, if you want to start.
I think the most difficult part for me was to pick an actual quit date. I know when you're reading the instructions for Champix, it tells you to have a quit date, and I couldn't. So I mentally tell myself, like, okay, 2 more days, and it got to a point where I was able to do my 12-hour shift without a cigarette, and I figured if I can do that, like have a cigarette in the morning, and then I just kind of weaned myself off that way.
Yeah, that's great. Kind of like, oh, already celebrating a success that you've noticed, right? Like, oh, that's a full 12-hour shift without a cigarette. That's a great way to start.
And then I have downloaded like one of the stop smoking apps, and for me, I think I'm more of a visual, like to see like, oh, I've done 24 hours, and once I did the 21 days, I was very pleased with myself.
Yeah, as you should be. What do you know the name of the app that you have used by chance?
I think it's just called Smoke Free.
Okay, great. I think I've seen a lot of people using that one and speaking highly of it. Having those milestones can be really helpful. So thank you.
Yeah.
Corey, how about you? What was the most difficult part of quitting, and how did you manage it?
Speaking from experience, well, I tried many times quitting, right? And each and every single time I tried saying, okay, this is it, kept on, right? Kept getting pulled into, peer pressure, friends going out, things like that. But I think there has to be a contributing factor externally that's going to drive you to quit. And my external factor was my grandmother, coming to me and saying, why are you doing that? So on and so forth. Someone that grew up had asthma, that was kind of like my turning point. And it kind of just, I don't know how to explain it, but it was almost like a switch went off in my brain and said, okay, that's it. And right there and then, that's when my body pretty much followed suit after my brain made that decision that, enough is enough, move forward. It didn't say that I didn't have withdrawals and everything that comes along with it, all the joyful feelings that comes with it. But once that kind of just went in my head, and it was enough is enough, and then I just kind of moved forward, So I think I always tell people this: you'll get to a point where one of two things: you'll get sick of it, you'll get sick of actually doing it every single day, and then or that switch in your brain will say, okay, enough is enough, and we're gonna quit, right?
Yeah, it's definitely a brain game, hey?
Yeah.
Yeah, for sure. Thank you, Corey. We've got another question about using the nicotine patch. So Chris, and Erica, this might be for you. After being smoke-free for quite some time, I find that I still get extreme cravings every once in a while. As the cravings sometimes last a couple days, I will use nicotine patches. Is this a safe way to manage my cravings? Chris, I see you nodding. You want to go ahead?
Absolutely. Like I tell like patients, it's like basically anything safer than smoking. And so if it's working for you, it's completely safe for you to be doing that. Some people are on them for years, not a problem at all. If it's working, excellent, keep doing it.
Awesome. Anything to add, Erica? Awesome. I guess just kind of building on that question too, like, yes, it's great. If that's working, then that's excellent. Like you said, pretty much anything is safer than smoking. But maybe for Corey and Rhonda, Jen, what are some other tips for managing cravings? I know we've kind of talked about a few of them already, but do you have anything to add for craving management? Jen, do you want to go ahead?
You know what, again, I feel like it's so individual. Like everybody's going to have different triggers, different things that they crave. But I do want to go back to what Chris had mentioned earlier. Like the medications really do help with a lot of that. And you know, I also just want to comment on something that that was already mentioned about the quit date. I think that's such an interesting piece. And we talk about the psychology. You know, our team has been floating the idea around, do we have a quit date? Like, I know it's important, but is it a journey start date? Do you know what I mean? Because as soon as you say you have to quit something, there's the psychological piece there. Like if I say, okay, I'm not having chocolate, that's all I think about. It's all I want, right? And so I feel like, you know, and understanding that it is a journey. It's a meandering journey. There's going to be days that we do better than others. There's going to be some setbacks. It's okay. It's really about the journey. And so we were toying with the idea of, you know, maybe it's just a quit smoking journey start date. Because even with a lot of the medications and our NRTs, you still can smoke for a little while too, right? So that way the pressure is still there. I don't mean to, you know, I don't want to downplay that, but it just changes the way we look at it a little bit. So I'm just throwing it out there. I think it's something worth discussing, and we'll certainly be reaching out to all of you, you know, for your feedback. But as far as you know, managing symptoms goes, there's always the 4 Ds that everybody, you know, tends to talk about with the cravings, right? Oh my goodness, it's going to challenge my brain here to think of them all. But you know, drink water. You know, Chris, can you help me? Do you remember them all? There's the 4 Ds, but you know, drinking water, going for walks.
Drink water, delay, distract. And why am I blanking on the fourth one?
I should know these off by heart too.
Dance.
Dance, is that what you said? It's not dance, but I love that as a filler. Yeah. But those are kind of the, you know, the 4 Ds are kind of that, you know, what people can do and think about. So we'll be sure to share that. How about in our follow-up email as well, Beth?
Awesome. Yeah, the 4 Ds. Rhonda, how about you? Oh, sorry, Chris.
Sorry.
Yeah, go ahead.
Deep breathing.
Yes.
Deep breathing.
Oh
there it is.
There it is.
I may have just looked it up.
As the lung girl, I can't believe I forgot the breathing one, for goodness sake. That's great. Thank you.
Funny. Rhonda, what are your thoughts on managing cravings?
My thoughts, I've just the drinking lots of water, and just that positive self-talk, like I can do it, I don't need it. I remind myself of the unpleasant things about smoking, and yeah, that's about it.
Yeah, no, that's great. I think water is a huge one. Hey, like I even think about like in situations for me when I need to like buy time or something, like I'll just have a sip of water. So I can see how that would translate nicely into distracting yourself and thinking about something different. Corey, anything to add in terms of managing cravings?
I think pretty much everybody said it already. Like for me, when I did try it before I finally made the decision, I chewed tons of gum. I know it's not the worst. Spits, ate a lot of those, probably a million bags of those. But I just continued to remind myself, to think, okay, I don't want this to control me. I want to control it. Using that mindset every single day I got up, right? And then just understanding that, I come from a line of, father and uncles, having lung cancer and dying, at young ages. And that was kind of like my driven factor of, okay, I don't want to end up like that. So I kind of used a lot of that too. But as far as triggering is, yeah, a lot of gum and tons of stir sticks and keeping my hands busy with, now we got fidgets. So, that's one thing, we didn't have that when I was trying to quit. So there's stir sticks and gum pretty much.
No, those are definitely helpful, I think, keeping the hands busy for sure. All right, well, one last question to close things off. It's World No Tobacco Day, so quitting might be on the top of people's minds as they maybe see some news releases about World No Tobacco Day. I know that the World Health Organization put out a big campaign, so people might be thinking about quitting. What is your advice for taking step one in quitting? So I'll maybe hear from everybody. What would be your best advice for step one if someone's thinking about quitting? Corey, I'll let you go first because you went last on the last one.
I think the first step is that harm reduction approach. If you're, even just in that pre-contemplation, is cutting down. Cutting down a little bit. If you smoke 10, cut down a little bit each and every day. That'd be your first step, kind of because when I was smoking, I didn't smoke as much, but when I did cut down, I found it was a little bit easier to kind of make that next step to, going down from 5 even to 3 smokes a day or whatever it was, right? So just that harm reduction approach, because I always say, if you're cutting down, hey, we're winning, and that's your first step to success, right? So.
Yeah, absolutely. Rhonda, how about you? What would be your advice for taking step one?
Mine would be just to make that choice. Once you make the decision to stop, then you just reach out for your supports, whether it's to your doctor or talking to someone else who has been there, or someone else who might be at the same stage as you where they're ready to quit, and you can lean on each other. It's just reaching out for supports and getting that help once you decide.
Yeah, that's great. Erica, go ahead.
Yeah, I was maybe just wanting to maybe build on or reinforce what Rhonda was saying. I think telling somebody, and telling somebody that you trust. So what I've heard a lot and seen with many of my patients who many of them have lung disease, and that's why I'm seeing them. And when they come in with their family members, many of them, particularly their spouse or maybe their children who are part of their lives, they're so wanting so much for my patient to quit smoking, and at times more than it might seem for that person. And so you might have family members where maybe your relationship and your life with smoking along with them has been conflict because it's okay. Maybe they're not the person that you necessarily go to talk about some of your challenges or your fears or the strategies that you're going to use someone that you can be open and talk about. And if you have, for example, a relapse or you smoke, that's okay, because that's actually expected to happen. And I talk with or someone that actually, as Rhonda said, has gone through the journey themselves, because they can relate to some of the challenges. So to find that person, because you're going to need someone along the way, and it doesn't really matter who it is. Don't assume that if you're married to someone or living with someone that would be the person you talk to. It doesn't have to be. It can be a healthcare professional or a person who's done it themselves.
Yeah, that's great. Thank you. Chris, go ahead.
So I was going to talk about building your support group as well, and that would include, family members. As Erica said, if there is that trust part there, it may not be family members, it may be friends, it may be also your pharmacist, your doctor, like identifying those people that are going to be there to help support you through the journey. I did just want to touch a little bit on like relapses as well, because I think a lot of times we call them quit attempts, and I don't really like to call them quit attempts. I like to call them quit successes, because you actually did quit. So every single time that you've quit smoking, you have succeeded and you have successfully quit smoking. You may have had a relapse, forgive yourself immediately and move on. And always tell yourself that you have successfully quit smoking on that part.
Yeah, I love that language. That's great. Jen, last but not least.
Oh, I'm all about that, Chris. It's really all about the journey. Thank you for saying that, because it's really, for us, again, it's about the language as well that we use, and that we want people to think about when you're using that internal language when you're speaking to yourself as well. So for me, it's about making that plan to start your journey. That's where the success comes from, right? And that's, as you said, Dr. Pens, it's having a support system, and it's talking to your healthcare providers, and it's figuring out what that plan is. Anytime any of us are going to make a big change in our life, we all have to do it, because when we're not sure where that road's going to go, if we don't have a plan when we get to that T in the road, we're probably going to take the path that we're used to. And so, Brene Brown has this beautiful quote that I'm going to share, because I just love it, and for me, it really speaks to that journey, Chris, that you just mentioned, with quote, relapse. The quote is this: "The willingness to show up changes us. It makes us a little braver each time." And I think every time when we're on our journey and it's meandering, we're learning, we're growing, and it's another step towards quitting. And truly, quitting is the best thing it's the best thing you can do for your health. And so that's what I will end with. That.
Awesome. Well, thank you so much. And I guess just with it being World Tobacco Day, and just a shout out to Jen, it's her 25-year anniversary working in tobacco control. So she's got a lot under her belt. And I know, Jen, you wanted to maybe share a couple of updates around World No Tobacco Day. Just a couple of words before we close off.
Sure. I just want to take this moment to say thank you, Beth. Thank you for organizing and for facilitating. You did a great job. And of course, you always pick a panel full of fantastic people. So thank you for your work on this. You do. You know how to pick. I just want to say, we didn't choose this date by coincidence. Today is World No Tobacco Day. Every May 31st, the World Health Organization deems this day as being a world day. It started in 1987, and it's really to draw global attention to the tobacco epidemic. And the reason why we call it an epidemic is because tobacco use is still the #1 cause of preventable disease and death in the world. So every year we lose 8 million people to tobacco use in the world. Of course, in Canada, that resonates to about 48,000 people. And in Saskatchewan, it's 1,600 residents. These are huge numbers. And so this is why we're so passionate at Lung Saskatchewan. We're here to help people quit. We also advocate for policy to protect public health. We work with the next generation with groups like Youth for Change to educate youth and to empower them with that decision making. So, what I always say too is, at the end of the day, most people start when they're kids. And if all of you who are on the call, think about when you started, you were likely a youth or a young adult. And so we just want you to recognize that you're in a safe space. Every year, it's World No Tobacco Day, sure, every year on May 31st, and it brings it a highlight. But at the end of the day, to the individual, please know that you've got a huge support system between your healthcare providers, between organizations like Lung Saskatchewan and the Pharmacy Association, etc. Just know that you've got a support system behind you. And today we definitely just want to highlight that the work that we do is for all the people that we've lost from the tobacco epidemic, but also all the people who are caught in that nicotine addiction web, I'll call it. We're here to help you quit, and the work that we do for the future. So I'll leave it at that. Thanks, Beth.
Thank you, Jen. That's a great way to end us off. So that will conclude our time together this evening. Thank you so much to our panelists, To Dr. Pens, Chris, Jen, Corey, Rhonda, thank you so much for joining us, for sharing your knowledge, your expertise, your experience with us. A big thank you to our sponsor, GSK, and to all of you who joined us. I don't know where you are in the country, in the world, but if you're in Saskatoon, you've joined us on a fairly nice weather evening. So thank you for taking the time to be with us. And we hope that the discussion tonight can support you on your quit journey. If you're not already a member of our Saskatchewan Quits Facebook support group, we hope that you will join us there. If you have any questions for our panelists that you didn't have the chance to ask this evening, or maybe I missed, please email me and I will make sure to get an answer from you from our panelists. And then lastly, this webinar was recorded and the recording will be sent out in the next couple of days via email, along with a link to provide some feedback on the panel discussion. So we would definitely encourage you to share your thoughts with us. Again, thank you so much to our panelists, to those of you who joined us this evening. Take care and have a wonderful night.